The birth of a child is a momentous occasion filled with joy and anticipation. It's a time of profound change, not just for the parents, but for the tiny new life entering the world. This transition from the safe haven of the womb to the outside world is a delicate one, and immediate newborn care plays a crucial role in ensuring a healthy start for the baby. These procedures, performed by skilled healthcare professionals, are designed to address the baby's immediate needs, ensuring proper breathing, stable body temperature, and protection from infection. The first new moments and hours after birth are critical, and these interventions are essential for a smooth and safe transition into life outside the womb. Skin-to-skin contact. Skin-to-skin contact, also known as kangaroo care, is a simple yet powerful practice where a newborn is placed directly on the parent's bare chest, allowing for physical closeness and warmth. This practice is typically initiated right after birth and has numerous benefits for both the baby and the parent. For the baby, skin-to-skin contact helps regulate vital signs such as heart rate, breathing, and body temperature, aiding their adjustment to life outside the womb. It also reduces stress and crying, enhances sleeping quality, and supports immune system development by exposing the baby to the parent's natural bacteria. Additionally, skin-to-skin contact promotes successful breastfeeding as the baby's instinct to nurse is stimulated, and the mother's milk production is enhanced. The emotional bond formed through this closeness also has long-term cognitive and emotional development benefits for the baby. For parents, particularly mothers, this contact reduces the risk of postpartum depression by fostering a sense of confidence and calm. And for fathers, it helps create a strong bond and provides an opportunity to connect deeply with their newborn. Practicing skin-to-skin contact regularly, especially in the early days, offers invaluable support for the baby's physical health and emotional well-being while enhancing the parent-child relationship. Delayed cord clamping is the practice of waiting 1 to 3 minutes after the birth of a baby before clamping and cutting the umbilical cord, rather than doing so immediately after delivery. This allows extra blood from the placenta to flow into the newborn, providing them with important health benefits. The main benefit of delayed cord clamping is that it increases the baby's blood volume and improves their iron stores. The additional blood transfusion from the placenta can increase the baby's blood volume by as much as 30%, providing extra red blood cells that carry oxygen. This helps prevent iron deficiency and anemia, which are common concerns in newborns, especially in areas with limited healthcare access. Babies who receive delayed cord clamping tend to have higher iron levels for months after birth, which is crucial for brain development. Delayed cord clamping is especially important for preterm babies as it has been shown to improve their circulation, reduce the need for blood transfusions, and lower the risk of complications such as intraventricular hemorrhage or bleeding in the brain, and necrotizing enterocolitis or serious intestinal problems. It also helps regulate body temperature and provides more stable blood pressure in the newborn. For mothers, delayed cord clamping is a safe practice that does not increase the risk of postpartum bleeding. It is a simple, low-cost intervention that offers significant health benefits to the baby, supporting their early development and long-term well-being. The Apgar score is a rapid assessment tool used to evaluate a newborn's health immediately after birth. It is conducted at 1 minute and 5 minutes after delivery and sometimes at 10 minutes if necessary. The score assesses 5 criteria. Number 1, appearance or skin color. Number 2, pulse or heart rate. Number 3, grimace or reflex response to stimulation. Number 4, activity or muscle tone. And number 5, respiration or breathing effort. Each category is rated on a scale from 0 to 2 with a maximum total score of 10, a score of 7 to 10 indicates that the newborn is in good health, while a score of 4 to 6 suggests the need for some medical intervention, typically related to breathing support. A score below 4 is a sign of critical distress requiring immediate resuscitation efforts. The Apgar score provides crucial information about the baby's physical condition in the first moments of life, guiding healthcare providers in deciding if further medical care is necessary. The vitamin K injection is given to prevent vitamin K deficiency bleeding, or VKDB, a condition that can lead to dangerous bleeding in newborns. Babies are born with low levels of vitamin K, a crucial nutrient for blood clotting. Without this injection, they are at risk of internal bleeding, including in the brain, which could result in long-term complications or even death. The injection provides a necessary dose of vitamin K, ensuring proper blood clotting until the baby's body can produce enough of it naturally. The hepatitis B vaccine is the first dose in a series of vaccinations to protect the baby against hepatitis B, a potentially life-threatening liver infection. Administering the vaccine at birth is important because hepatitis B can be transmitted from mother to child during childbirth, and early vaccination significantly reduces the risk of newborns contracting the virus. It also provides long-term immunity against hepatitis B, which can cause chronic liver disease, liver failure, or liver cancer later in life. Both interventions are safe and essential for protecting newborns from serious health risks, ensuring a strong start to life by preventing bleeding disorders and viral infections. Taking anthropometric measurements for a newborn is a crucial part of evaluating the baby's growth, health, and development immediately after birth. These measurements help healthcare providers establish a baseline for the baby's physical status and allow for the early identification of any potential health issues. The main measurements include weight, which is taken using a calibrated scale to determine if the baby falls within a healthy range for their gestational age, and to identify issues like low birth weight and macrosomia, or being larger than average. Length or height is measured from the top of the head to the heel using a measuring board or tape to monitor growth patterns over time. Head circumference, measured by placing a tape around the widest part of the baby's head, is essential for assessing brain development and detecting conditions like microcephaly or macrocephaly. Occasionally, chest and abdominal circumference are also measured to provide further insight into the baby's overall development and organ growth. These anthropometric measurements are critical for determining if the newborn's growth is within the normal range for their age and sex, and are compared against standard growth charts. Regular monitoring in the early days and weeks after birth ensures that any deviations from typical growth patterns can be promptly addressed. The application of an identification band on a newborn is an essential safety measure taken immediately after birth to ensure accurate identification and prevent any mix-ups in the hospital. As soon as the baby is delivered, an identification band is placed on the baby's wrist or ankle, containing important details such as the baby's name or baby of mother's name, date and time of birth, sex, and a unique identification number. In most cases, 2 bands are applied to the baby, one on the wrist and one on the ankle, to provide additional security. The mother or primary caregiver is also given a matching band with the same information to ensure the correct baby is always returned to the correct parent. Throughout the hospital stay, healthcare providers regularly check the baby's identification band before any medical procedures, such as vaccinations or treatments, ensuring proper care and reducing the risk of misidentification. The simple yet crucial practice plays a significant role in safeguarding the health and safety of newborns and their families. CRIDS prophylaxis is the application of an antimicrobial eye ointment to a newborn's eyes shortly after birth to prevent neonatal eye infections, particularly ophthalmia neonatorum a type of conjunctivitis that can be caused by bacteria like Neisseria gonorrhea or Chlamydia trachomatis. These infections can be transmitted to the baby during childbirth if the mother has a sexually transmitted infection. Left untreated, these infections can lead to serious complications including blindness. The procedure involves applying a small amount of erythromycin or tetracycline eye ointment to the newborn's lower eyelids. Usually within the first hour after birth, the application is quick and painless, and the ointment is spread across the eye by gently closing and opening the eyelids. This prophylaxis is highly effective in preventing infection and is a standard practice in many hospitals worldwide to protect the baby's eyesight and overall health. Where, if an infection does occur, early detection and treatment can prevent permanent damage. Quids prophylaxis is an important part of newborn care, safeguarding the baby's eyes from preventable infections. Temperature regulation for newborn is a critical aspect of newborn care because newborns, especially those born prematurely, have limited ability to regulate their body temperature. Maintaining an appropriate body temperature is essential to prevent hypothermia or low body temperature or hyperthermia or high body temperature, both of which can lead to serious health complications. Newborns lose heat quickly due to their large surface area compared to body weight, thin skin, and limited fat stores. To support temperature regulation, newborns are typically placed in a warm environment immediately after birth. Skin-to-skin contact with the mother is one of the most effective methods as it allows the baby to absorb warmth from the mother's body while promoting bonding. Additionally, newborns are dried off quickly to prevent heat loss through evaporation, and warm blankets or hats are often used to cover them. In medical settings, if the newborn is premature or at risk for temperature instability, they may be placed in an incubator or radiant warmer, which provides a controlled environment to maintain their body temperature. Maintaining a stable temperature is crucial because if a newborn's body temperature drops, they expend energy to generate heat, which can affect their blood sugar levels, oxygen consumption, and overall well-being. Proper temperature regulation supports the baby's transition from the womb to the external environment, ensuring healthy growth and development. Feeding initiation for newborns and hygiene practices are crucial aspects of early care that promote the baby's health and well-being. Feeding initiation typically begins within the first hour after birth, with breastfeeding being the preferred method due to its numerous benefits for both the baby and the mother. Early initiation of breastfeeding, often referred to as the golden hour, helps stimulate the production of colostrum, the nutrient-rich first milk, which provides essential antibodies to protect the newborn from infections. This also promotes bonding between the mother and the baby, helps stabilize the newborn's blood sugar levels, and aids in regulating the baby's body temperature. If breastfeeding is not immediately possible, formula feeding may be introduced. Regardless of the method, early feeding helps to establish proper nutrition and hydration, which is vital for the baby's growth and development. Hygiene practices for newborns are equally important to protect the baby from infections and ensure overall health. Care should begin with proper cord care, where the umbilical cord is kept clean and dry until it falls off naturally. Regular diaper changes are necessary to prevent rashes and maintain cleanliness, with the baby's genital area gently cleaned and dried after each change. Bathing the newborn should be done carefully, usually a few days after birth, once the body temperature is stable, using lukewarm water and mild soap. However, frequent bathing is not necessary. A sponge bath can suffice in the first days of life. Additionally, caregivers should practice hand hygiene by thoroughly washing their hands before handling the baby to prevent the transmission of germs. In conclusion, the initial moments after birth are a delicate yet crucial stage in a baby's journey, from the vital interventions of immediate newborn care to simple yet powerful practice of skin-to-skin contact. Every step is designed to ensure a smooth and healthy transition into the world. By understanding these procedures and embracing these practices, we can provide the best possible start for our precious newborns, laying the foundation for a lifetime of health and happiness. Thank you!